Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Leg cramps, 10 reasons why you have them, and some solutions that you can utilize at home to minimize leg cramps. So let's get right into the video. A lack of salt may be a reason or a cause. So there's often a lack of salt in the diet due to the promotion of reducing salt intake overall. Now, if you do get leg cramps, what you want to do is use Redmond's real salt. You can use 1/4 to 1/2 teaspoon per day. You can use it in your foods, or you can mix it into your water and drink it, and that might help reduce your leg cramping. Electrolyte imbalances. Things like magnesium, potassium, and calcium are utilized for contraction of muscles and relaxation of muscles. Therefore, you need to have proper levels. So you can utilize magnesium about 200 to 300 milligrams per day. You can use that at night, so you can try to avoid the night cramping. Potassium, approximately 80 milligrams of potassium citrate. You can also use calcium, 200 to 300 milligrams. I prefer food sources for that, so you can utilize things like sardines and so forth. Now, medications also create a lot of issues with cramping. Things like statin medications, osteoporosis medication, birth control pills, pain medications, calcium channel blockers, diuretics, and antibiotics. Oftentimes what I find is patients are on maybe multiple medications and they're developing cramps. So you need to talk to your physician about what might potentially be causing the cramps, okay? Overexertion. Now this is a big one where you're slightly deconditioned, you work out one day, you go back to the gym the next day feeling sore, and you push yourself a little bit too much and you'll start to develop cramps. And that's really just post-exercise cramping or someone who's deconditioned and overworking things too quickly. Pregnancy. About 30 to 50% of women who are pregnant will experience some sort of cramping at night, especially in the legs, okay? Deep vein thrombosis, or DVT, is usually in one leg, and you'll have pain and squeezing sensation in that leg. You will also have some swelling typically in the leg because the return circulation is poor. So one leg will be a little bit larger than the other. Birth control actually contributes to deep vein thrombosis. So if you're on birth control pills, they say the incidence is about 10 to 15 per 100,000 women who are on birth control. Could be probably higher than that. Females who are obese and on birth control pills will have 12 to 24 times the incidence of deep vein thrombosis than the regular population of women who are not on birth control. Sitting for long periods. So this is a trigger for deep vein thrombosis. So let's say you are on birth control, female, in your, let's say, 20s and 30s. You fly overseas and you're sitting for long periods of time. You get up, you start to feel squeezing sensation in your leg, some pain. Then you may actually have a deep vein thrombosis or blockage in the vein. The way you can check for deep vein thrombosis is something called Homan sign. This is when you lie flat on your back. You can have someone push your foot up towards your head with your leg straight and squeeze the calf muscle. If you develop pain and tenderness or discomfort when you do that, you may have deep vein thrombosis. You probably will need to go to the emergency room, get an ultrasound done, and so forth to determine if you have deep vein thrombosis. Peripheral artery disease, or PAD, usually related to cardiovascular disease, diabetes, smokers. They will get clotting of the arteries in the lower extremities or the smaller arteries. So diabetes is another big one. So you can do what we call ankle brachial index. This is when you go to your doctor and they do a blood pressure in your arm and they can do a blood pressure at your ankle. And if there's a wide variation in blood pressure, you may actually have peripheral artery disease. You need probably an ultrasound to make sure you don't have that condition in particular. So number 1 through 5 is pretty common. 6 and 7 is common, but not often thought about when you think about leg cramping. Now, let's go to number 8. Cirrhosis of the liver has been associated with it, as well as kidney disease. Lumbar stenosis and peripheral neuropathy. Lumbar stenosis is basically anything that narrows the canal where the nerves come down from the brain. So the brain, spinal cord goes all the way down, and then it splits down into different nerve roots. Now, if you have stenosis, basically you have narrowing of the lumbar spine or the lower back area, and that's impinging upon the nerves or the neurovasculature. So the arteries can be also indirectly compressed. So typically with stenosis, what happens is if you walk, you stand up and you walk, and you start to walk maybe a block or two, you start to notice some discomfort in your legs, and then pain and weakness. So stenosis can occur. Stenosis can be anything from a large disc herniation, degenerative disc disease, a large bone spur, anything that narrows the canal, okay? It usually affects both legs, but it can affect one leg also. Peripheral neuropathy is basically you lose sensation in your legs, and you're starting to lose some of the circulatory aspects of it. And major cause is diabetes, where you have numbness or tingling in the lower extremities and cramping. You could have also something they call idiopathic peripheral neuropathy, and this is usually related to food proteins and diet and so forth. Thyroid or hypothyroid can also cause cramping, and parathyroid issues. Parathyroid regulates calcium, so when you want to look at parathyroid, you look at your calcium number and your phosphorus number, and if they're off or outside of the lab ranges, you want to go ahead and check to see if you have normal parathyroid hormone levels in the blood. Okay, so considerations and solutions. Really, number 1, you need to stretch. Stretching your feet, your calves, your hamstrings, your quadriceps, and your hip flexors. Those are all necessary on a routine basis. Hydration is very important. Oftentimes people are just drinking coffee or tea, and that can be slightly dehydrating. So you want to make sure you're getting at least 8 cups of water. I prefer at least half your body weight in pounds. Divide that by half and drink that in ounces. So I'm 150 pounds. You want to drink 75 ounces of water per day. You can drink obviously more than that. Exercise is very important. Improves circulation. So regular normal exercise is great for improving circulatory aspects of it, but also muscle contraction and building muscle tone. Sleeping on your side and back is much better than sleeping on your stomach. So if you sleep on your stomach, it also creates this what we call a lordosis in your lower back, and it also creates problems when you get up in the morning feeling stiff and sore. So sleeping on your side with a pillow between your knee. If you're sleeping on your back, you want a pillow underneath your knees, just kind of propping your legs up a little bit. Proper footwear is also necessary. Oftentimes people have foot issues and they don't have the right shoe or sneaker and so forth, and just puts abnormal fatigue and stress to the calf muscles. So proper footwear is very important. B vitamins, you need B vitamins to produce energy or ATP. You need ATP to have muscle contraction. So you need proper B vitamins. B12 is also very important for things like peripheral neuropathy. Pickle juice. So that's an old method of helping with leg cramps. So you can use pickle juice. It's basically salt, right? Walk on sand. Moving your toes and your feet and getting proprioception into the legs will also help improve circulation and muscle tone. So walking on sand is really good if you're near a beach. Eliminate alcohol. Alcohol can be dehydrating, and also a lot of people who have excessive alcohol intake tend to be a little bit malnourished. So you want to definitely eliminate alcohol from your diet. Raynaud's, which is a circulatory issue where your hands and feet will become either purple or even white because of lack of blood flow, which leads to another problem is anemia. Anemia like iron deficiency anemia. Iron is necessary for muscle contraction also. So iron deficiency anemia, megaloblastic anemia, pernicious anemia. There are a variety of different circulatory issues related to anemias. So you want to make sure anemia is corrected. You can also utilize essential oils like peppermint, eucalyptus, or lavender. You can take a little bit and just rub it into the musculature. Helps to relax the area. I think an anti-inflammatory diet is crucial. So reducing inflammatory food proteins. You can start with maybe doing gluten-free and dairy-free. In more aggressive cases, you can do what we call an autoimmune paleo diet or an AIP diet. You can also use apple cider vinegar. Apple cider vinegar has a little bit of potassium in it. It's about 11 milligrams per teaspoon. Improves digestion. So I think apple cider vinegar will help break down the foods and assimilate better the carbohydrates, proteins, and fats that you take in. So it would improve your mineral levels by just improving digestion overall. It also has a pH balancing effect. Even though apple cider vinegar is acidic, once it gets into your systemic system, it helps to alkalize the body a little bit or balance the pH a little bit. And I think that's great overall. So you can look at all these different solutions and mechanisms. You don't have to do all of them. You can try some of them and see if that helps you. There are probably two other things that I didn't mention in the board. One is arachidonic acid. Arachidonic acid is in fatty meats or like seafood. Arachidonic acid can be both inflammatory and pro-inflammatory or anti-inflammatory, but it is necessary in order to do proper muscle contraction and relaxation. So having fatty meats and fish may be helpful with cramping. Another one is quinine. You can utilize a little bit of quinine water, but with that comes a little bit of a warning that it has some adverse effects for some people. So you want to talk to your physician about drinking quinine water. All right. So these are all the different factors related to leg cramps. Let me know what your condition is in the comment below and what your solution was to help you improve with the leg cramps. All right. We'll see you guys next week on the healthy side. Have an awesome day.